This video is for you if you're pregnant and have been told that your unborn baby may be small. If you're a partner, relative, or friend of someone in this situation, this information is also for you. You'll learn about possible reasons why your baby may be small, how to reduce the risk of your baby not growing well, how a diagnosis is made, what extra care you can expect. This information doesn't apply if you're expecting more than one baby. What is meant by a small baby during pregnancy? Your baby is considered small if, at a certain stage of pregnancy, their estimated weight or size is in the lowest 10% compared to other babies. That means they are among the smallest 10 out of every 100 babies. What affects your baby's birth weight? Your baby's weight can be influenced by your height and weight. Taller and heavier individuals tend to have heavier babies. Whether you or your partner were small at birth. Your ethnicity. For instance, South Asian women tend to have smaller babies. How many babies you've had. Birth weight tends to increase with each pregnancy. Your baby's gender. Boys usually weigh more than girls. What could cause your baby to be small? In some cases, your baby might be small simply due to genetics and may still be perfectly healthy. However, sometimes a baby is small due to growth restriction, which could be caused by a poorly functioning placenta, medical problems like high blood pressure or preeclampsia, smoking, drug use, or severe anemia, infections during pregnancy, developmental or genetic problems. What increases the risk of your baby not growing well? Risk factors include smoking, overexercising, or poor nutrition, being over 40, high blood pressure, kidney problems or diabetic complications, a history of pregnancy loss or having a previously small baby, heavy vaginal bleeding, especially in the second half of pregnancy. Can you do anything to reduce the risk? Yes, some risks can be reduced. Quit smoking. Ask your midwife or GP for support. Avoid recreational drugs. Maintain a healthy lifestyle and diet. If you're at risk of preeclampsia, you may be advised to take low-dose aspirin, 75 milligrams, from week 12 onwards. What does being small mean for your baby? If your baby is small but healthy, there's usually no cause for concern. If growth is restricted, there's a higher risk of stillbirth, illness, death shortly after birth. Outcomes depend on how early and how severely the growth is affected. What happens if a small baby is detected? You'll receive extra monitoring for your baby's growth and well-being. You may be advised to give birth early to ensure your baby is delivered safely. How will you know if you're having a small baby? Your midwife or doctor will assess this. If you're low risk, your baby's growth is measured at each antenatal visit using the symphysis fundal height method. If growth slows or seems small, an ultrasound scan is advised. If you're high risk, you may get regular scans from weeks 26 to 28. A uterine artery Doppler test may be done between weeks 20 to 24 to assess blood flow to the placenta. What other tests might be offered? You may undergo umbilical artery Doppler, checks blood flow through the cord, cardiotautograph, CTG, monitors baby's heart rate, amniotic fluid measurement. You may be referred to a fetal medicine specialist for further assessment if needed. When is the best time for your baby to be born? That depends on your baby's growth and Doppler results. If growth is stable and Doppler results are normal, waiting until at least 37 weeks is ideal. If problems are detected, your healthcare team may advise an earlier delivery. Is there any other treatment? You might be offered corticosteroids over 24-48 hours before birth to help your baby's development and reduce the risk of breathing issues after birth. How will you have your baby? If there are no other complications, you may have a vaginal birth with close monitoring during labor. If Doppler readings are abnormal, a cesarean section may be recommended. Go to the hospital immediately if you go into labor, your waters break, you have any bleeding before your advised delivery date. Where should you have your baby? You'll be advised to give birth in a hospital with a neonatal unit. Whether your baby needs neonatal care will depend on their size and the timing of birth. You may get a chance to speak with the neonatal team or visit the unit in advance. What if you have questions or concerns? Speak with your midwife or maternity care team. They're there to support and guide you. Further clinical guidance is available in the RCOG Green Top Guideline number 31, titled The Investigation and Management of the Small for Gestational Age Fetus. This information was developed by the RCOG Patient Information Committee based on the RCOG Green Top Guideline number 31. The full guideline and sources are available at this link. This information was reviewed by women attending clinics in Belfast, Glasgow, Kirkcaldy, Newcastle, and Birmingham. You can find a glossary of medical terms at this link. If this video helped you understand more about having a small baby, don't forget to like, share, and subscribe for more informative content. And if you have any questions, experiences, or thoughts to share, drop them in the comments below. We'd love to hear from you.